Hey everybody, this is Liam from Compliancy Group. We're going to give all the other attendees just a minute or two to hop on. Thank you for all who are already here and signed up and made the time to sit in on this webinar with us today. We're going to be going over some pretty important topics for those of you that fall under macro MIPS. And so we have a very special guest with Dr. Karen Perry, who's going to be doing the majority of the presentation. We're just going to give it a quick minute here so that everybody has the ability to get logged in and set up with audio. So we'll come back on the line in just a couple of seconds. Alrighty, so it seems like the number of attendees has slowed to a trickle, so we should be good to go to get started here. One thing, just to quickly introduce myself, my name is Liam. I'm our Senior Account Manager here at Compliancy Group, so any specific questions related to HIPAA or compliance, you can direct my way. There's my email there. It's just ldegnan@compliancygroup.com. Keep in mind, everything that you're going to be hearing today, this entire webinar is recorded. All of our webinars are recorded. So if you ever wanted to check out any of our other free resources, we have dozens of free webinars online that you can have access to, both new ones coming up and also previous webinars that we have done in the archive. Feel free to check out our blog for most current and up-to-date articles, infographics, white papers, and as always, there is a question and answer feature inside of the GoToMeeting that you are more than welcome to use as we go through today. Usually, as you go through, if there's a question that you have, just go ahead and post that in the question box within the GoToMeeting, and then me and Dr. Perry will address all of that at the end. Really, to give you everybody just a little bit of a backdrop in terms of introducing our company. We are, of course, Compliancy Group, and everything that we do is built around the idea of taking what can sometimes be cumbersome and confusing requirements and simplifying it for your practice so that you're more able to focus on your business and do what you do best, which is caring for your patients. So we're the endorsed solution of over 42 different medical associations and specialties nationwide. We've been around for 14 years. We've got over 100,000 users currently utilizing our platform. We've never had a customer in the history of our company fail any type of a HIPAA audit investigation or be fined. So we would love to be able to assist with anything along those lines. And I mention that just because we really do know what we're doing. We didn't just read a book about this and are coming on now to try to get you on our platform. But for the purposes of today, we are going to have a very special guest. We have Dr. Karen Perry with Compulink Healthcare Solutions, who has kind of come together with us for the sake of rolling out a little bit more effective solutions for their clients and for ours as well. We have a very good partnership, and so I'm going to go ahead and pass it off to her. She is going to be the one kind of facilitating the majority of the webinars. We talk about the MIPS security risk analysis. And so, Dr. Perry, I'm going to go ahead and pass this off to you. Do we have you there?
Thank you, Liam. I am here, and I'm very happy to be a part of today's webinar and very pleased to participate in this program. So I'm going to go ahead and share my monitor. Just confirm that you can see my monitor now.
Yep, that's coming through very clear.
Perfect, perfect. Well, once again, I want to say thank you to the Compliancy Group for inviting me and Compulink to participate in this program today. This is kind of a exciting time for Compulink and the Compliancy Group in that we're developing very strong partnerships to help bring better solutions to our clients in an effort to make sure our clients are prepared and supported as we move through the various programs under the Quality Payment Program. So once again, my name is Dr. Karen Perry. I'm the Director of Professional Relations and Government Programs here at Compulink Healthcare Solutions. And my email address is on the screen. If you'd like to email me, feel free to ask any questions regarding macro or MIPS. You can reach out to me anytime. As Liam had mentioned, we do have a question and answer session. At the end of the session, we'll be opening the audio lines at that time as they're in listen-only mode. The session is being recorded, And if you'd like a copy of the session, just reach out to Liam or myself, and we can get you a copy of that. And it will also be posted on the Compulink website as well as the Compliancy Group's website. So let's go ahead and get started with our presentation for today. As everyone pretty much knows, or you wouldn't be on the call today, that MIPS requires, as a part of their Promoting Interoperability program, the security risk analysis. And at Compulink, we want to make sure that our clients are ready to attest by meeting this objective. And it's really important to know that 25% of your score is at risk if you do not participate or do not perform this particular objective. So keep in mind that with this objective, it's kind of a silent killer out there. They're not giving any points for it this year, but they are requiring it, and they are doing audits. So we need to make sure we're cognizant of that. So again, today, I'm just going to briefly touch on HIPAA, and then I'm going to go into defining what a security risk analysis is about as it falls underneath the MIPS and macro program. I also wanted to touch base on the 21st Century Cures Act, as everyone who's attesting will have to attest to the information blocking criteria. We're going to discuss how to conduct security risk analysis, sort of like in a 6-step method, and then briefly touch on a few myths that might be floating around out there, and try to kind of clarify some information about that. And then we're going to talk about a comprehensive security risk analysis and give you some resources. I'll pass the ball back to Liam. So as you all know, the HIPAA rule consists of 3 main criteria, and those criteria are the privacy rule, the security rule, and the omnibus rule. Now, under the privacy rule, this really is what is protecting the patient's health information and allowing that patient to have some decision-making ability as to how their information is disclosed and used. So this is really about how you protect the patient's information where it comes to sharing that information with other entities. The security rule is what I'm going to be discussing today in the context of the security risk analysis. And the security rule requires that providers have safeguards in place to make sure that they're protecting the health information that's electronic and in your office, and that you have certain, again, safeguards in place to protect that information. Now, the security rule that I'm going to be discussing consists of 3 different criteria as well. You have to do a technical audit, a physical audit, and an administrative and privacy audit. So we're going to be talking about all 3 of those today. Now, the last portion of the HIPAA compliancy rule is the omnibus rule, and that discusses if there is a brief notification of 500 or affecting 500 or more clients or patients, you have to investigate and report within 60 days. It also consists of your business associates agreement, which has to be in place before you start engaging in business with a client. And again, a technical due diligence that should be conducted to ensure that data is actually being protected. So with that being said, I'm going to go ahead and move into the main portion of my webinar, which is the 1/3 of the rule, the security rule. So basically, MIPS does require, under their Promoting Interoperability category, the measure specification of a security risk analysis, and you'll see that image here on your screen. The security risk analysis requires that you conduct and review a security risk analysis in accordance with the Code of Federal Regulation requirements that are listed here. Now, this rule includes that you must address the security, which includes encryption of the electronic protected health information data, which is created and maintained in your Compulink software. And they also require that you implement security updates as necessary. So for instance, if you conducted a security risk analysis last year, 2 years ago, or 3 years ago, you must implement any security updates that you mentioned in your security risk analysis from year to year, and you must correct any identified security deficiencies as a part of creating your risk management process. So eligible clinicians must use, in order to conduct the security risk analysis and to comply with the PI rules for this year, you must use the 2015 edition. I think I put 2019, my apologies there. the 2015 edition of ONC Certified Electronic Healthcare Technology to support the Promoting Interoperability Performance category. Now, keep in mind, promoting interoperability is all focused on your electronic health records. The analysis must be conducted when you implement your electronic healthcare technology. So if you're a new client to Compulink and you're implementing the software, you need to make sure that you're also conducting a security risk analysis. If you're doing an installation or a major upgrade, you need to make sure that you also revisit your security risk analysis to update all of the data within that. The review must be conducted covering each MIPS performance period. So remember, your MIPS performance period under the Promoting Interoperability is a 90-day performance period. So if you're doing a 90-day performance period right now, so from October 1st to December 31st, you'll need to make sure that your security risk analysis dates cover that period. Your security risk analysis or your risk management process or your risk management report must include any security updates and deficiencies. So once again, don't be afraid of the fact that you're not meeting all of the criteria under the security rule. What you have to be afraid of is the fact that if you don't address any of the security updates or the deficiencies, that would be something that you need to consider making sure that you're addressing those issues, because that's where ONC will get you if they do an audit. I think there were a couple of other points on that. Nope, not on that slide. So basically, the timing of the security risk analysis, remember that your security risk analysis can be reviewed and conducted outside of the performance period. Your performance period is January 1st through December 31st, and this analysis must be unique for each performance period or the performance year. So the scope must include the full 90 days MIPS performance period, and it must be conducted within the calendar year of the MIPS performance period. So that's kind of confusing because the MIPS PI performance period is 90 days, but the MIPS performance period that you're reporting for the quality program is going to be January through December. The security risk analysis must be unique for each calendar year. So if you're compiling a security risk analysis, you need to make sure that you have updates for that security risk analysis. And I will pause here for just a moment to let you know that the Compliancy Group has a program that takes care of all of these criteria for you, so you really don't have to worry. It's not a one and done. It will take some effort on your part. It does take some understanding of the security risk analysis program, but you need to make sure that you partner with the Compliancy Group to help you conduct these risks, because they are at a very high level. So basically what the security risk analysis includes is you must assess the potential risks and the vulnerabilities to the confidentiality, availability, and integrity of all electronic PHI within the organization. And that's anything that's created within your organization, either electronic or that you've printed out or that you've copied and put on an e-fax and faxed it over to somebody. It's in all different modes and forms of communications. So again, the electronic communications that's included in this particular rule includes those old floppy disks, CDs, DVDs, any smart cards, any thumb drives, storage devices. And again, it means any portable electronic data, specifically your iPhone. So if you do access Compulink from your iPhone or iPad, again, it includes all of those items. So those all need to be included in your security rule. You must implement and correct any identified security issues as a part of the MIPS rule. And this means that if you notice that you have insufficiencies, I'll give you an example. For instance, if your server is sitting in a room that does not have a lock on it, and this information is not included in your security risk analysis and your risk profiles, then you need to make sure that you address it and put a lock on the door, and that you update your security risk analysis to reflect that you have made reasonable and appropriate efforts to comply with the rule, and you've implemented all of the measures sufficient to reduce the risk and vulnerability of your server that may be sitting in a room that's unlocked. You must show a plan for correcting and mitigating the deficiencies. So again, in your security risk analysis, you'll have a step-by-step plan, and I'll show you an example of that later in the presentation. Again, once the security risk analysis is complete, you're going to be able to take a deep breath and kind of smooth sail, because your risk management plan will be done, it'll be in place, you'll be HIPAA compliant, and you should be able to pass any OCR or CMS audit if you've worked with the Compliancy Group and had them work on your risk audits as well. So failure to meet this measure as it applies underneath the Quality Payment Program MIPS reporting for 2019. If you fail to meet or fail to comply with the security risk analysis, CMS will score all of your objectives as a big fat 0 because you didn't meet the compliance under this particular rule. So each of the 4 objectives must be reported or excluded or scored, and including your security risk analysis. So that kind of makes 5 objectives altogether. If the security risk analysis is not completed under the promoting interoperability measures, then you will get a 0 for failure to meet the security risk analysis on the promoting interoperability rule. So again, this affects 25% of your overall MIPS composite score. This is another area that I wanted to touch base on because it is important when you go to a test, either with your registry or directly with CMS. They're going to require that you meet the information blocking criteria that falls underneath the 21st Century Cures Act. Underneath this act, they wanted to prevent any entity or healthcare provider from knowingly and unreasonably interfering with the exchange or use of electronic health information. This has a lot to do with where we're going as a nation with healthcare. They want to be able to make sure that all patient information can be accessed by the patient and shared with the other patient's caretakers in a reasonable period of time, and to try to do that electronically. So we're really moving into more of an electronic era, and they want to make sure that we are not blocking the use of our technology. So for instance, turning off the ability to communicate electronically in our software, or fees that make it impossible for a patient to be able to pay for their electronic health data, organizational policies that will prevent the terms for sharing with patients or sharing with other healthcare providers, technology that's implemented in non-standard ways that inhibits the use of the electronic health records data. So for instance, if you shut off something in Compulink that prohibits the sharing of information, that would be, again, an information blocking technique. Again, information blocking can go to vendors. It can fall under a lot of different, players within the healthcare field. So for the most part, we want to make sure that the information that you store within your electronic health records is provided to patients and their care providers and not locked in due to specific technology or healthcare record network that is not portable, does not provide the information. So this information blocking states that you have to attest to 3 different information blocking criteria. So if you're reporting as a group, the prevention of the information blocking attesting by the group applies to all and individual MIPS eligible clinicians. This means that if one of your clinicians within the group is blocking or preventing the sharing of information, the whole group will fail. These are the statements. I'm not going to read these statements piece by piece, but you can go ahead and review the deck if you'd like. I can send you a copy of the deck, or Liam can send it to you as well. But these are the actual statements. The first statement just basically says that you're not going to take any action to limit or restrict the capability of interoperability within the EHR. The second statement just supports the first statement. It says that you've implemented technology, standards, and policies within your practice to ensure that the EHR information was available, it was connected, that you were able to exchange the data, and that you allowed timely access to patients, and you also allowed secure and trusted bi-directional exchange of the structured data. Now, this is all built into the software. The software does not do it for you, but you do have to make some initiative to do this by virtue of the other promoting interoperability activities. But again, these are the statements that you will have to attest to. And again, they're just asking you on statement 3 to respond to patients' requests and other healthcare providers' requests in a timely manner. And we define timely manner in some of our other presentations. So let's look at this information blocking again, because it does get a little tangled up into the healthcare rules. And I'm going to just give you an example that if a healthcare provider restricts access to a patient's sensitive health test results, so for instance, if a patient has cancer, and the patient has not been informed that they have cancer, the clinician who ordered those tests may withhold that information until he's informed the patient before he transmits that information to another healthcare player within that patient's care. So once again, you kind of have to use some logical, strategic approaches to understanding these healthcare rules. And that's why the Compliancy Group and Compulink are working in an effort to help our clients understand these rules. So keeping with the HIPAA regulations and HIPAA rules, the restriction does not apply to the patient or anyone else to whom the patient has requested in writing to provide this information. So if the patient wants a provider, say their nursing home caretaker or a family member to have this information, again, that patient can assign a release for their caretaker to get that information either simultaneously or after the sensitive results are released to the patient. So with that being said, let's kind of move into what is required by HIPAA under the security risk analysis and performing a risk analysis. So a covered entity or business associate must implement policies and procedures to prevent, detect, contain, and correct security violations. Now, this all gets into conducting an accurate and a thorough assessment of any of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of your EHR information. Now, when I say availability, this availability can be anyone who's cleaning your office, anyone who happens to walk down the hall, like a pharmaceutical rep, a contact lens rep. All of these people have access to your EHR system by virtue of just a glance or looking over the shoulder of somebody who's working in the system, maybe taking an inventory. So again, you have to have a security risk analysis protocol in place, that you do a business associates agreement with these entities or these business associates to ensure that they have implemented their aspect and policy and procedures to prevent access to information. So basically, what does the security risk analysis need to include? Well, I'm not going to go through every single step within today's presentation because that would take us from here until Christmas. And I'm sure you don't want to be spending Christmas with me on the phone on this WebEx, even though I'm sure many of you would enjoy it. Just kidding. We can't have the ability just within an hour to cover everything. So I'm just going to give you some high-level overviews. So basically, you need to ask yourself, have you identified where the protected health information or electronic PHI resides? You know, where is it sitting? Is it sitting on laptops that your staff is taking home on a daily basis or uses remotely to access information, like for billing purposes? Have you assigned a security officer within your clinic that oversees the HIPAA security risk analysis and oversees the steps that need to be in place? Do you have a breach notification plan in place? Do you have a contingency plan? Do you have the business associate agreement in place with all of your business associates? And again, this includes pharmaceutical companies. It includes your cleaning service. It includes anyone who comes into your office for any type of that has access to your electronic health information, or even information that happens to be sitting on a desk, like papers that you print up, billing and coding information with the patient's name on it, that kind of thing. So most importantly, do you have policy and procedures on your device and media controls? So for instance, how social media is conducted within your office, how you're conducting emails within your office, text messaging. So these policies and procedures all need to be in place, and they need to be addressed within your security risk analysis. Do you have an inventory list that includes all of your devices and your medical equipment that has electronic health information on it? For instance, if you have an Optos or you have an OCT that stores electronic health information, is there an inventory list in the event that you have a crisis and or there's a storm that blows out all of the electronic devices and you can't recover that information? You know, if something happens to that. So basically, you need to have a thorough inventory list available. Are you monitoring your audit logs? Are you educating appropriately? Again, do you have a mobile device and remote use policy and procedure in place? One of the highest level of problems that we see are laptops being stolen out of backpacks that are sitting in vehicles, or you happen to take it in a restaurant, go to the restroom, come back, and it's gone. The laptop may not be encrypted with information, and someone can, again, access all of the healthcare information that's available. The Compliancy Group does a great job at giving examples in some of the Office of Civil Rights penalties that have occurred. I won't go into those today because we are focusing on really the aspect of the security risk analysis. But I did want to touch base on a few of the OCR investigations. The compliance issues investigated, the most are impermissible uses and disclosures of protected health information. That means that people have accessed patient information without their permission. The lack of safeguards that are in place, like I just discussed that example, somebody can walk right in and walk right into the room if they happen to go to the bathroom, and your server is sitting right there next to the bathroom. They might be able to access that information if that server is not locked and in a secure area. The lack of patient access to their health information. So if you've restricted patient access to their information, or you don't give them timely access to their information, again, this is an OCR rule, and they investigate it, and they do audits, and they tell you that they're going to fine you and take money from you based on these audits. Disclosure of more than minimum necessary information. So remember, one of the rules under HIPAA is that you just have to release the necessary minimum information that's required. Lack of administrative safeguards. We've talked about this again. If you don't have a policy in place and administrative safeguards to protect PHI, then you will be in violation of these rules. Some examples of penalties. Again, stolen unencrypted thumb drive garnered a $150,000 penalty from the Adult and Pediatric Dermatology Group. Again, I'm just going to hit on a few of these. Stolen laptops, again, at the Concentra Health Services was a $1.75 million fine. This is big fines, and they're not playing around. They're very serious about protecting health information. $50,000 fine to Hospice of Northern Idaho due to unencrypted laptops stolen. And again, these are all these laptop situations. But some things that people may not realize is that when you copy information or you put information on a fax, your fax and your copy or retain the images of that information. So if you want to be a good guy and give your old copier to somebody that's at the at the wellness shelter or something like that, and you think it's a good thing to do, you need to make sure that you make appropriate safeguards to wipe out those hard drives before you give it to them, because Affinity Health Plan had to pay $1.2 million for exposing protected health information on a photocopier. So let's talk now about some important definitions. And again, we talk about EPHI. We throw these little words around. I just wanted to kind of touch base on a few of the words. Again, this is individually identifiable information that's created, received, or maintained or transmitted by or on behalf of a covered entity. That's you, and that relates to any health care or health payment. Again, that's an official definition. The Compliancy Group will probably do a better job at embellishing upon it. But that's really just basically anything that identifies the patient. A covered entity is any healthcare provider, insurers, clearinghouses that deal with protected health information. And a business associate is anyone who performs functions or activities on behalf of or on certain services. A covered entity that involved the use of and disclosure of PHI, and I kind of reviewed that in just a few moments ago. Vulnerability refers to flaws or weaknesses in your system that may result in a security breach or violation of the system's security policy. So this can be a technical or a non-technical issue, but this creates and it opens the door, creates a weak link within the system that will expose your system to certain bad guys who want to get in there and play around and take your information. A threat is the potential for a person or a thing to exercise that specific vulnerability. So you have to address this in your security risk analysis. And threats can be natural, meaning natural disasters, hurricanes, fires, that kind of thing. They can be human or they can be environmental. So basically, I want to just, again, touch base on those important definitions. The most important one, though, is the risk. And this, again, is the outcome of a particular threat that will exercise, accidentally or intentionally exploit a particular vulnerability, and that results in the impact if that should occur. So risks can arise from legal liability or a loss due to unauthorized disclosure, modification, or destruction of information, or unintentional errors or omissions. And again, this is again what that security risk analysis is all about identifying the risk of the vulnerability and the actions that you put in place to secure that information. Again, you failure to exercise due diligence and take care to make sure that even your business associates have a policy in place. So really, it's not just about signing a business associates agreement. It's about really ensuring through due diligence that they have policies and procedures in place. So let's talk a little bit further about the security rule itself and the three components that make up the standards of this rule. Those three components are going to be administrative, physical, and technical audits, and we're going to talk about this in a little bit more detail. So under the security rule, you basically have covered entities must maintain reasonable and appropriate administrative, technical, and physical safeguards to protect the electronic patient health information. You must ensure the confidentiality, integrity, and availability of this information that's created or maintained or transmitted. And again, this could be paper or it could be in the electronic form. And you must identify and protect against reasonably anticipated threats. And the last item here is that you're going to protect against reasonably anticipated impermissible uses or disclosures. And again, this means people who hack into your systems. These are the bad guys that are out there who are trying to get your information and possibly charge you to get that information back. So again, and most importantly, you must ensure compliance by your workforce. You must educate your staff and ensure that they are in compliance at all times. And this means keeping a watchful eye out for any activities at your front desk that unfortunately your staff might be discussing PHI, not realizing that there's maybe a rep around or even after hours. This may offend somebody. It might be a patient that's related to a staff member. So you have to really make sure that you are in compliance and your security officer within your office is kind of has oversight as to what those policies and procedures are and make sure that they implement them. So here we're going to talk a little further about the first step of this rule. This is the administrative safeguards that you're taking and the standards that apply to this process. You must do a security risk analysis. You must have a risk management policy in place, and you must also have a sanction policy. You must also educate your workforce on the security authorization supervision of health information. And again, have security and awareness training on password management. Changing your passwords frequently is a part of this rule. And the Compliancy Group has, again, safeguards in place to help you understand more about how you can comply with this information. You must have a contingency plan in place, and this must be documented in your policy and procedures as your data backup plan. In case something happens, that there is a failure of the data, how is that handled? If those of you are on the cloud, access the information from the Compulink's health manual. We do have all of that information in our help manual to help you comply with these security rule standards. And once again, your security associate contracts need to be in place, a written or other arrangement. But I would recommend that you have a written agreement with all of your security individuals who have access to your information and keep a file on each of those. Talking about the physical safeguards. Now, again, this is protecting the access controls within your facilities, making sure that you have security to get into your office, security to get into your computer system. A facility security planning would include any maintenance records. So, for instance, how often do you update your windows? How often do you modify any access that the staff has online to social media, to emails, workstation use? Who has access to the workstations? Do you allow patients to use your internet links to get your Wi-Fi? You know, these types of things are really important in addressing in your security risk analysis plan. How is information disposed of? So, for instance, the example I used with the copier earlier, how are those disposed of? Are they securely disposed of? Do you have the identification numbers that are associated with each of your pieces of equipment? When you sell those pieces of equipment, do you know that the data has been securely eliminated from that information? Also, how are you backing up? My apologies, I might just go back to that again. How are you backing up your data? How is it being stored? If you're on the cloud with Compulink, you can access the specifications in our help manual. If you have any questions, feel free to reach out to me. The technical specifications of the security rule standardizes access controls by unique user identification, automatic log-off. So, for instance, in the Compulink system, you can set up how often there's an automatic log-off in the system. Person and entity authentication. So if you're using a two-step authentication, say for instance, when a person logs into the software, a text is sent to the patient or to the staff member that gives them a 4-digit ID number to, again, allow them to identify that they are who they actually are, and they have their provided access to the information. So two-step authentication is becoming more and more common, and I do know that Compulink is probably going to be moving in this direction soon. Again, transmission security. Is your information encrypted? In addressing encryption, I had a couple of slides on that, but I think that's really deep into the security rule. And if you have questions on that, the Compliancy Group can obviously answer those questions. As far as encryption for Compulink and anyone who is on server or on our cloud, that information, again, can be accessed in our help manual. And the Compliancy Group works closely with us to also help design those programs for you. So what are the 6 steps to really conduct your security risk analysis? Well, the elements of the security risk analysis is you need to identify the scope of the risk that's involved in your office or in and outside of your office as well. You need to be able to assess the risk. What level of risk is each of those items? So for instance, if your staff carries a laptop around, is the laptop encrypted? Is it unencrypted? Does the laptop have a secure passcode on it? Does it have two-step authentication? Again, these elements are really critical for you to understand, assess how data is collected, and identify any potential threats or vulnerabilities, and then assess any current risk security measures that you need to put in place to make sure that you've assessed your risk and put those in place. You want to evaluate the risk. That means determining the likelihood on a scale maybe of 1 to 5. Again, the Compliancy Group can show you how this is done. What would be the likelihood of a certain threat occurrence? What's the potential impact of that occurrence? And what is the level of risk? And again, I talked about ranking the risk. I'll show you an example in just a moment. So also you have to create a plan to address the risk and do a periodic review. And that doesn't mean just once a year, but if say Compulink updates to a major update, you need to make sure that that update complies with the security risk analysis and all the documentation that you have in place. So taking a look at identifying the scope, what's in your network. So this identifies the scope of all of the PHI that you collect, whether it's photos of a patient, whether it's in your electronic medical records, your copiers, your mobile devices, all of the information that's out there. If you do save documents on your iPhone, you again need to make sure that you identify all of the scope of your entire network, including any type of the diagnostic equipment that you use, scanning pictures at the front desk, any of those devices at all. Administrative safeguards, again, this is in identifying the scope. You need to take certain safeguards. There's 3 different areas of identifying the scope of the security risk analysis. You need to develop a security management process and implement policy and procedures in your office to protect and detect any security violations. You need to perform the security risk analysis, and again, this is the required action that you have to document. Conduct a thorough and accurate assessment of any potential risks and vulnerabilities, and then you have to implement physical safeguards and controls within your facility to protect that information. We just talked about that a few moments ago. Again, the door or the lock on the area of your server in your exam rooms, screen protectors. Being able to make sure you shield your screens at the front desk and in the exam lanes, having automatic log-offs that are within a reasonable period of time. So say, for instance, if you have a student in your practice and the student forgets to log off and they leave the PHI up there, a patient could get up and access the PHI. Again, you need to develop a facility security plan that is addressable, and this would implement policy and procedures to safeguard the facility and all the equipment from unauthorized access. The office policy and procedures identify the controls that prevent unauthorized physical access, tampering, or theft. You need to make sure that you have all of that information in place. So you have to ask yourself several questions as we're going through this presentation. Are all of these policies and procedures in place? Are they updated? Have you addressed them within the 2019 year, within the performance period? And especially if you are planning on using the last quarter this year in your performance period, these have to be updated within the performance period. Technical safeguards, we've talked about a little bit again. These are implementing technical security measures to guard against unauthorized access, and this includes encryption of your software. Again, Compulink can help you address that, and the Compliancy Group works close with us on that. The second step is assessing the risk, and this is pretty straightforward. This is interviewing your key personnel, looking at your clinicians, your practice manager, your HIPAA privacy officer, any in-house or external counsel that you use that can access the information. So again, you want to assess the risk of anyone within the office to accessing that information. You would review key documents, previous internal, external audits, and consulting reports. Again, your policies and procedures, contracts with hospitals, your contracts with other physicians. So if you do send PHI out or other physicians into your practice, or students come into your practice, vendors, pharmaceutical companies, all of those guys play a huge role in your documentation and assessing your risk. You also must have a training course in place. Whether this course is online or it's in written format, you must have it in place. You must train your staff. And this doesn't mean just do a training for an hour every year or so. When your systems are updated, when your policies and procedures are updated, you need to make sure that your training is in place and the staff signs off and they've updated that information. Now, again, the Compliancy Group provides these solutions for you and really makes these all very simple and very seamless. You also need to assess the risk for external sources of information, anything that you're pulling in from an outside vendor or outside resources. Any government information, any, let's say, for instance, you are bringing in data from a clearance house, guidance, bulletins, anything like that that might be brought in from an outside resource. So any professional resources or medical societies or trade associations can provide sources for information to help you assess risk. But again, you need to turn to the Compliancy Group. They have all of this in one place. It's just a turnkey program for a very, very minimal amount of money. Let's look at evaluating your risk. So once again, in evaluating your risk, you need to look at the risk or the likelihood of a violation of your risk over multiple dimensions and what that impact is to the office or the organization. So again, if you have a high risk of someone getting into your server, maybe after hours, someone was hired by the cleaning company and they just happened to have been released from prison because they've hacked into other systems and they went to work for the cleaning company and all of a sudden they have access to your information. So again, what's the likelihood that that the government could discover this particular violation on your behalf? So this is basically a evaluation of your security risk analysis. You'll see on the left side the impact of the severity, whether or not the impact would be severe, serious, or moderate to your office. Would it cripple your office if there was a violation of your information? Let's say, for instance, somebody hacked into your system, captured your information, you got a virus and you couldn't access the information. How severe is the impact to your office and into your daily operations? And again, you need to look at what the likelihood of the occurrence is. So the likelihood of that occurrence could be remote, possible, or it could be probable. So again, you would rate these based on this scale, and then you would come up with a ranking. This is an example of the risk of an unencrypted laptop. And so for instance, this would be a possible risk that it could happen. Because an unencrypted laptop might be floating around in the office or might be taken home by an employee, and the likelihood of the risk is possible. And I'm going to kind of go over here. This is a possible likelihood, but if it does happen, the impact of the severity would be extremely high or high. An encrypted laptop, again, it's possible that it could happen, and the impact of severity would be low because the person that's the bad guy that's out there would have to be able to break the code for the encryption to be able to access the data. The ranking of risk areas, again, this is a sample ranking. Again, the Compliancy Group may have this information in a different format, but these are following the standards that are set forth by the security rule. A sample ranking might be critical risks, might be access to your EHR. A high risk would be access to mobile devices. Medium risk would be information that might be stored on copiers, and then a low risk would be threat of the desktop computers, but the desktop might be encrypted. So again, you have to rank the risk areas depending on the particular area of the software that's being accessed. Let's talk about creating a plan to address the risk. Again, you need to make sure that plan is in place. It needs to be documented. You need to be able to access it and update it on a routine basis. So a work plan is basically a list of projects or actions that need to be conducted and then you need to take that work plan and put it into an actionable work plan. And these are objectives, provisions, and maintenance of detailed documentation of HIPAA security, the documentation of the practice's good faith effort to comply with federal and state security requirements, and a demonstration of the effectiveness of your security program. So just to embellish upon that statement, if, for instance, you put a policy in place, but you have determined that the effectiveness of that policy isn't really working and you need to modify the effectiveness, you need to be able to demonstrate the effectiveness might be low, and you're going to make modifications to address that particular risk in your work plan. So again, it may not be a perfect work plan. You might have vulnerabilities and risks there, but at least if you show a good faith effort to comply with the federal and state security requirements, you should be able to not be penned by an audit by the government. So this is an example of what a work plan would contain, and this would be specific actions and the party responsible, any budgets that are associated with that work plan. So again, the resources that are required and the date that plan would be completed. And you'll see below just a little graphic of how that plan might be put in place on paper. And I believe that the Compliancy Group has this all in digital format, and they would be able to help you work through this if you're an enterprise client or a large client that would need to address these issues. The last, not the last, but the next to the last is a periodic review and updates to your risk analysis. Again, I've talked about this already. Prior to any updates or changes in the EHR system, you need to make sure that you review your policy and procedures. And again, the potential risk of any violations that might occur. Documentation from previous years that would be demonstrating that you have implemented the risk analysis process. Making sure that you have updated dates on your policies and your procedures. So for instance, if your policy was put in place in 2014, you need to show that you modified the policy and have a list of those modifications in an area that's associated with that policy and procedure and the dates that those areas were addressed. So again, there's 6 simple steps to the compliance program. Number 1, you need to appoint a policy person that's in charge of the policy. That would be your HIPAA privacy and security officer. You will need to update your notice of privacy practices and make those compliant. You would also need to make sure that you have a business associates agreements in place, and you do implement that with each and every business associate you deal with. You need to make sure that you have appropriate policy and procedures and your staff is educated on those. You need to implement a regular workforce education plan, make sure that that's in place, and make sure that that's documented on a register that they log into and they sign off that they have been educated on the security risk analysis and on the HIPAA plans and policies. You need to make sure that your encryption protection is accessible, that that's in place. Again, we've talked about that being available through the help manual in Compulink, and then again, your risk assessment and other electronic and physical safeguards that you have in place. There are 6 myths that I'm going to go over for the security risk analysis. And basically, the first one is the security risk analysis is optional for small providers. Well, no, that's not true. That's false. Anyone who's a covered entity under HIPAA has to have a security risk analysis in place. And again, this falls under the HIPAA law. It's not just for those who are eligible clinicians under the EHR incentive payment programs. It must be done for all to be HIPAA compliant. Simply installing the EHR fulfills the security risk analysis meaningful use requirement or PI requirement. No, that's not true. Again, you must perform a full security risk analysis on your own. We do not have a jurisdiction over your physical safeguards. We do not know what's happening in your office. So basically, we put encryption on our software. We make sure that we are compliant as a company, as Compulink works very hard to make sure that all of these requirements are in place. Just work with Compulink to fulfill any area of your security risk analysis that would be applicable to making sure that you have policy and procedures in place to fulfill these recommendations or these criteria, My EHR vendor took care of everything and I need to do about privacy and security. Again, no, that's not true, although we would love to. We have the Compliancy Group right there in place, standing ready and ready to help us make sure our clients get through everything they need to get through. But again, it's solely your responsibility to make sure that you complete the security risk analysis, and that's conducted on an annual basis, and it is conducted during the performance period. A checklist will suffice for the security risk analysis. Nope, that's not true. Again, you must have all of your security risk analysis documented and performed, and more than just a checklist. I only need to do a security risk analysis once. We've addressed this already during our presentation. So basically, you need to fulfill that security risk analysis by updating your policies and making sure that those are all in place every year to address all of the risks. Before I attest an EHR incentive program, I must fully mitigate all risks. Yes. And no, excuse me. The EHR incentive program requires that correcting any deficiencies during the reporting period, you have to identify those deficiencies and have a plan in place to correct those deficiencies. If there's a risk that's unidentified, then again, you haven't identified the risk, so you can't really correct something that you don't know about. So this is kind of yes and no. You're making an effort to correct the risk, and you have documented it. So as long as there's documentation in place to fulfill the security risk analysis and to mitigate any risks, you should be fine. So again, the Compliancy Group does a really good job at reviewing all of these penalties for non-compliance. So all I've done is created a slide here that really shows you basically the HIPAA violation, the minimum penalty, and the maximum penalty for these violations. So for instance, if an individual did not know that they violated HIPAA for some reason or another, there can be anywhere from a $100 violation up to a $50,000 violation, and an annual maximum of $1.5 million. A HIPAA violation due to reasonable cause and not due to willful neglect, meaning that you tried to comply with HIPAA, but you didn't realize that you were neglecting the policies that were in place because perhaps maybe an employee did something and they weren't educated in that area. There can be anywhere from $1,000 per violation. Now, this means per patient. So if there's 5 patients involved, that's $5,000. If there's 50 patients involved, $50,000. You can really rack up the dollars here. And this can go all the way up to $50,000 per violation per patient. Now, again, I want to reiterate, this is not just per patient. This can be per violation per patient. So this can rack up some hefty fines. A willful neglect and violation is corrected, again, $10,000 to a $50,000 fine, and any violation that's due to willful neglect and is not corrected, the violations can go up to $50,000 per patient per violation, and then and max out at, again, high levels. So I'll let the Compliancy Group go ahead and take this from here because they're really good at understanding those penalties for non-compliance. They do a great job at helping you avoid those penalties and putting systems in place, such as a security risk analysis, and reensuring that all of these things are taken care of. So Liam, with that said, I'm going to take it back to you. Thank you again for your participation, and thank you for sharing this time with us today. Liam, back to you.
Wonderful. Thank you so much, Dr. Perry. That was very, very educational, extremely helpful. And like Dr. Perry was just saying, something that you'll find, the interesting thing with every HIPAA fine that has ever been levied, okay, so even just this past week, 2 of the larger fines that we've seen this year so far, one was an organization, okay, that had unencrypted devices that resulted in a breach, okay. They were audited, okay, but they were ultimately fined not because of the unencrypted devices in and of themselves. They were fined because they had been found to have not conducted an annual risk assessment that would have identified that need, right? There was another organization 2 years ago that lost the laptop, right? They were not fined because of the loss of the laptop. They were fined because they could not prove that they had policies and procedures in place related to the use of those laptops, right? So a lot of you might be in a position where a lot of this can seem kind of scary, but what it all comes down to from a HIPAA perspective is good faith effort, right? Because if those organizations had done what they were responsible for doing under HIPAA and setting forth those policies and procedures, conducting that risk assessment, even in the event that you have a breach, it is still extremely defensible because, again, the government themselves are not bulletproof, right? They don't expect you to be. but they do expect you to implement an effective compliance program, conducting that security risk analysis in a way that is actually going to impact the way that you operate your practice. And so that's all things that we're here to help with, right? So through the use of our and just talk about us very briefly to give an overview and an idea. If all of this sounds very overwhelming, we're ultimately here to keep all of this very simple for you, okay? Our methodology, we'll bring you through a process where we'll not only help you achieve these things through the use of our software and a dedicated coach on our end that will guide you through all of this. We do all of the documentation for you. We respond in the event of a government audit. We'll also track everything to make sure that it's being maintained year over year. Because if you think about the overall security risk analysis requirement of HIPAA and of MIPS, it actually breaks down into those 6 individual audits covering technology, your administrative requirements, your privacy requirements, okay? All of these different things that come into play. The way that we would conduct that assessment with you is actually right inside of our software. We have boiled down those audits and that full assessment into very simple, plain English questionnaires for you to go through, okay? Very simple, very easily understood and filled out, so that just by you answering those series of questionnaires, we're actually then able to complete the remainder of the assessment process for you. Because if you think about those 5 steps, right, it's first identifying the scope, assessing the risk, and evaluating the risk. All that we will ask you to do is answer those questionnaires inside of the platform, and it is going to be pretty deep, right? So it might take usually about 3 hours to get through those questionnaires, but we are then the ones that evaluate, we assess, and we will not only identify the gaps that you have, we're going to put in writing for you actual remediation plans, so you have a very clear game plan and a roadmap of what now needs to happen within the practice to become HIPAA compliant. The rest of our process with you, and usually you'll have between 5 and 8 30-minute meetings with a coach where they guide you through these things. The rest of our process is going to be actually filling in and addressing those deficiencies, right? So it could be policy and procedure related. We provide you with every single policy and procedure that you might need to be HIPAA compliant as templates that you can then customize, put into your namesake. All of this is tracked for you so that once we get you through this process, we then let you know what needs to be done to maintain all of it from that point on, year over year, whatever that may be. We're going to provide you with virtual training modules that you can use with your staff, along with a platform where they can attest to your policies and procedures, because of course, having policies and procedures is great. Doesn't always mean a whole lot if you're not able to prove that you reviewed it with the staff, right? We, of course, address things like business associate agreements, making sure that you have just a platform where all of that is tracked, providing you with that documentation if you need it, and also an incident management plan so that in the event that something goes wrong, we can assist, we can walk you through how to handle it. We'll make sure that everything is kept up to date and documented appropriately. So the whole approach of this, okay, is to take these requirements and give you a very simple methodology that you can follow to get it all taken care of. That's what we do. That's what we're here to help with. And so we partner very closely with Compulink just to make this service available to any practices that might need it. So if you're interested and would like to learn more about the service, please feel free to reach out to us, reach out to Dr. Perry. We would love to be able to help. And so with that here, that is going to conclude the content that we have for the webinar today. I'm just checking the question and answer box really quickly to see if there were any questions that came through. The one and only question is, how do I get a copy of these slides from Alan? If you would like a copy of the slides from the presentation today, or an actual recording of all of the content that we went over, please reach out either to me. You can email me at liam@compliancygroup.com, or reach out directly to Dr. Perry, and we'll make sure that we get all of that for you. Dr. Perry, are you still with us?
I am, Liam. Thank you.
Wonderful. Just wanted to thank you very much again for doing this with us today. Really appreciate just the overall education and the expertise that you bring to the table. It's tremendously valuable to us. And as always, I hope everybody has a great day. We really appreciate all of your time. All right.
Thank you, Liam, and Compulink's appreciative of our partnership with the Compliancy Group and all you bring to the table to ease the burden of these regulatory factors within the client's practice. So Once again, please reach out to either Liam or I if you have any questions. My email is kfp@compulinkadvantage.com. Thank you again.
Awesome. Thank you again, Dr. Perry. I hope everybody has a wonderful day and a great holiday coming up.